Good afternoon and welcome to our briefing on COVID vaccine for First District Health Unit area. I'm Lisa Clute, Executive Officer of First District Health Unit. These are exciting days for our community and for all of us that have worked so hard. In public health, vaccinations have always proved to be one of the most effective tools we have to control the spread of infectious disease. So we have received a lot of calls in the last few days asking about the vaccine. So we wanted to take the opportunity to tell you what we know and what we don't know yet. And Lacey McNichols is here. She is the vaccine coordinator at First District Health Unit, has done an outstanding job keeping track of all of the information coming out, and I am going to turn it over to her. She is going to talk with what is going on within our 7 counties and vaccine.
Hi, my name is Lacey McNichols. Like she said, I'm a public health nurse at First District Health Unit. Like she said, we've been getting a lot of calls and emails from the public asking questions about COVID. So we wanted to take this opportunity to address some of those questions that people had, so people kind of knew what was going on in our communities. As we all know, the Pfizer vaccine has been approved by the FDA for emergency use. The ACIP, which makes recommendations on all vaccines in the United States, also met over the weekend and made some recommendations for the Pfizer vaccine and around COVID vaccines. And some of the Pfizer vaccines have already been shipped into our state. So you've been hearing a lot about that Pfizer vaccine, but there's also a second vaccine that's coming out, and that's called the Moderna vaccine. It's been submitted to the FDA, which will meet on the 17th to go over the safety and efficacy data. The ACIP is scheduled then to meet on Friday, December 18th, and possibly on Sunday, the 20th, if needed, to discuss recommendations around that Moderna vaccine. Because this is following the same schedule as the Pfizer vaccine, we expect that Moderna vaccine will be rolling out at this time next week. At First District Health Unit, at least the first shipment we plan to get is the Moderna vaccine. The state has prepared us to accept both vaccines, but at least with this first shipment, we expect to receive Moderna. The Trinity location here is expecting to receive Pfizer vaccine. Some of the recommendations that happened at the ACIP meeting I wanted to talk about, because that's what people are having lots of questions on. First is the schedule. Both vaccines are 2-dose schedules. The Pfizer vaccine is separated by 21 days, and the Moderna vaccine is separated by 28 days. So there is a difference based on brand. If you happen to miss that second dose by that 21 or 28-day mark, we recommend that you get vaccinated as soon as possible, but they don't recommend restarting the series. So when you go in to get the vaccine, you should schedule for that second dose so you get it on your calendar and get that second dose. The vaccine for the Pfizer, the age group was down to age 16 and older for the vaccine. The Moderna vaccine was studied in ages 18 years and older, so there may be a difference in age recommendations between the brands, which is common with vaccines. Even the flu vaccine, different brands go for different age groups. So that's common practice that we see in immunizations. So that's some information that we'll be looking at in the next few days. The COVID vaccine brands are not interchangeable. So when you start with a certain brand, you have to finish with that brand. So we recommend that you would go to the same clinic for your first and second doses to make sure that you get that same brand. The government will be issuing cards, paper cards, that staff can write down the date and the brand, so you can carry that with you. And then our electronic records will also document what brand you received. With other vaccines, the COVID vaccine, when it was studied, it was not studied being administered with other vaccines. So the recommendation is that 14 days before the COVID vaccine and 14 days after the COVID vaccine, you should not receive another vaccine. So there should be 14 days before and after that you don't take other vaccines. A big question we get is, I've already had COVID, should I get the vaccine? And the answer is yes. You should wait until at least your infectious period is over and that your symptoms are improving. There is no minimum interval between infection and vaccination. What we do know is that reinfection with COVID vaccine is unlikely within the first 90 days of infection. So if you want to wait the full 90 days before you get vaccinated, you can, but you don't have to. There is no minimum recommendation for when you should get vaccinated. If you've had a known exposure to a COVID vaccine and it's your turn to get vaccinated, we ask that you wait out your quarantine period before you get vaccinated, because we don't want to expose personnel who are doing the vaccinations. And keep in mind that vaccines are prevention, they're not treatment. So if you've been exposed to COVID and you turn around and get a vaccine, that vaccine's not going to do you any good. You need to get that vaccine in your arm before you're exposed to COVID. Vaccines may be administered to people with underlying medical conditions who have no other contraindications to vaccines. So the vaccines were studied in people who have things such as COPD, asthma, diabetes, heart disease, and it was proven safe that you can, with those chronic conditions, that you can get the vaccine. So we do recommend that those people do get the vaccine. However, immunocompromised people, there isn't enough data to make a general recommendation. So for example, people who are living with HIV, who are currently taking cancer treatments or on long-term steroid therapy, they should talk it over with their doctor and go over the risk and benefits with their doctor. So there's not a general recommendation for that group of people. And then the ACIP also said that pregnant and breastfeeding women may also choose to get vaccinated. And again, we recommend that pregnant and breastfeeding women discuss it with their doctor before they choose to get vaccinated, and get vaccinated at their doctor's office if they so choose to do that. So reactions to the Pfizer vaccine are mild to moderate. It includes pain at the injection site. About half of the recipients experienced a headache, chills, fatigue, and muscle pain. You can also experience a fever. And some less common but more severe actions were severe joint and muscle pain and severe fatigue. Most reactions happen 1 to 2 days after vaccination and last a day or two. It's important to remember that not everyone will experience these reactions to the vaccine, but it's important to know about them, so if it happens to you, you know that that's normal. Reactions were more common with the second dose. It's important to note that if you do receive or experience some of these reactions or several of them, it's important that you still complete the vaccine series. So go ahead and go back in to get that second dose. So the Moderna vaccine has very similar reactions, and that includes fever, headache, and fatigue. It's important to remember that these are unpleasant reactions, but they're not dangerous. Full protection from a vaccine usually occurs 1 to 2 weeks after the second dose. So it's also important to remember that no vaccine is 100% effective. So in the meantime, we still need to do those things to help spread COVID, such as wearing a mask, maintaining 6 feet from other people. In our community, in the state of North Dakota, we're currently vaccinating healthcare providers on the front line. Hospitals in our area will be vaccinating their own staff. First District Health Unit's focus on the first round is go out to the EMS members in our community, as well as healthcare providers at clinics that aren't receiving COVID vaccine. As we get more vaccine, we can move through these priority groups that are set by the state. Once we move into a new priority group, we can let the public know. But at this point, we don't know when the general public will be vaccinated. That is put out by the state at their ethics committee. So we don't have any better guess than anybody else at what priority groups will be coming up next. We're getting a lot of phone calls at our clinics asking to be put in on a waiting list or to schedule a clinic for businesses. And that's just something we're not doing at this point. We just have a lot of other things that we need to focus on and get through before we start that process. I also wanted to bring up that COVID vaccination clinics will be different than flu clinics. A lot of people are used to coming to our flu clinics and experiencing a clinic like that, but COVID is going to be different. The vaccines need to be handled very carefully. The vaccines come in multi-dose vials. So once you open that vial, you only have a certain amount of hours to use all those doses in that vial. So there's a lot of planning that goes on behind the scenes. We can't just open a vial and vaccinate one person that walks in our door. We're also in the midst of a pandemic. So the days of us opening the door to a walk-in clinic and saying, everybody come on in, just aren't happening right now. So we're gonna have to rethink the way we hold mass clinics. You have to remember our healthcare staff are stretched thin. We'll do our best to get the vaccine out as fast as we can, but we also have to maximize our staff time. So in flu seasons, you're used to seeing us going out to different businesses and holding different clinics in the community. We might be asking more people to come in and see us just to help maximize our staff. And then one of the big questions that we get from people is expressing concerns over how quickly the vaccine came about. And I just want everybody to realize that the safety, efficacy, and science behind the COVID vaccine took no shortcuts. The partnership called Warp Speed between the United States Department of Health and Human Services, the United States Department of Defense, and the private sector what that group did was give the drug manufacturers more resources to help develop a vaccine. The drug companies had to provide safety and efficacy data in the same way they would have had to for any other vaccine approved in the United States. In fact, there's actually been more added measures to make sure the vaccine is safe this time around. The drug companies are utilizing existing technology. The mRNA vaccine has been around for years and been studied for years. Drug companies were able to start manufacturing the vaccine as soon as development was complete, which is different than any other vaccine. So companies have been making doses for months now. A drug company on its own would never be able to take that financial risk of having those doses go to waste if the vaccine wasn't safe or effective. So the government kind of took that risk out for them. And keep in mind, the race to develop a vaccine started in January 2019, once the scientists got the genetic code of the virus. And often that process takes years, but the fact that this was done so quickly is another reason why scientists were able to develop the vaccine so fast. And it's important to note that safety and efficacy data will be continued to be collected once the vaccine is rolled out. So that's the information I had to provide with you today. And I just want to tell the community, to stay tuned. We're going to keep you updated as much as we know about the vaccine and how quickly we can get it out in the public. We're going to do our best to get it in the arms of people as quick as we can. So does anybody have any questions?
I have a question related to additional vaccines that might be coming out. Do you have any idea of timeline and how that might affect the vaccination schedule?
No, we don't have any idea on timeline, and they're all in different groups. I don't know if you have more to say on that, Lisa, but we don't. The goal was to have 3 or more. So at this point, no vaccine is even close to being further along as these 2.
You mentioned that the genetic code was developed on January of 2019. Was that 2019 or 2020? Because we didn't even know.
Oh, I'm sorry, 2020.
Okay.
Sorry. Yeah. Yes. And luckily we got lots of people to help us make that information or make that decision. I don't know, do you want to talk on that or do you want me to? Okay.
We have pulled together all of the healthcare providers within our 7 counties. We have met every Tuesday for several weeks now, preparing for this day. And so we know exactly how the doses will be spread out throughout the 7 counties. There were 3 very small healthcare facilities that asked for our assistance. So we can assure that all healthcare facilities within the 7 counties will have vaccine available for their workers. Along with that, we have worked with the emergency managers throughout the 7 counties. They have been assisting us and developed questionnaires that they have sent out to all of their law enforcement, fire, EMS staff. And we have tentative dates scheduled to begin vaccinating those EMS, law enforcement, and fire. Right now, it looks like our doses are going to match the need, but we don't have all surveys back in. We are very pleased to see that most first responders throughout the 7 county, a high percentage of them are interested in being vaccinated. Some wants more information, and we will continue to try to provide that as it is available. So plans are in place. The long-term care facilities will be vaccinated by pharmacy, and those are federal contracts that have been put into place.
Do you have a number of doses that you're going to be receiving? And this is it next week that you're going to be getting everything you need, or how does that going to work?
Shipments will come in. We will be alerted, I believe, each Friday on the number of doses coming in. Next week, we have 200 doses coming in. And so our plan is to begin vaccinating the vaccinators. And then the following week, we will begin, the following week, we will begin with the EMS and law enforcement and, well, emergency responders within the 7 counties. We've identified 4 sites throughout the 7 counties, and they will be invited to attend either one of those sites to get their first dose. As Lacey said, this takes a lot of coordination because we have to know exactly how many doses we need at a facility because once we open a vial, we have 6 hours. And so our planning will assure, our planning and organization will assure that not one dose of this vaccine is wasted, and that's a high priority for us. So
Next week. Is that the first district health unit only, and those 200 doses are going to vaccinate the vaccinators? And then how is it going to get to the healthcare facilities?
the healthcare facilities all are identified as providers, and their vaccine goes directly to them. First District is there to fill in the gaps. And so we are filling in the gaps with emergency responders and a small amount of healthcare providers that were not able to vaccinate themselves.
Will funeral directors be included in those emergency responders?
No, funeral directors are not included in the first round. Any other questions?
Will First District be offering any public resources for members of the public to go ahead and read up on the vaccine, pros and cons, and other side effects?
First District will continue to provide information as quickly as we have it available to the public. So watch all of your media sources. Go to the website, fdhu.org. That is where we load the documents first, the studies. Everything that we have, you will have access to. And obviously Facebook, social medias, news releases like this. So as always, our priority is to keep the public informed as to what we know and what we can do, and I just have to commend everybody within the 7 counties, all of the healthcare providers that are working so diligently to get this out in a quick and efficient manner. And like Lacey indicated, this is different for us. And the vaccine comes with different requirements than what we're used to. However, First District Health Unit, boy, we know how to vaccinate. And we can vaccinate large numbers very quickly and efficiently. So stay tuned. And as Lacey said, there is no waiting list. So we will announce and give you as much heads up as possible as to the next groups that we're going into. So just stay tuned to your local news media outlets.
If there's a first responder that hasn't heard about this, is there anyone they can contact to try to make sure that they get on the list to vaccinate?
They can if they're in the counties, go ahead and contact their county nurse. They can find that on our First District Health Unit website. If they don't know their or if they don't know who their county nurse is, they can call our hotline, which I don't know the number off the top of my head, but we'll get you that hotline number.
Okay,
And then, or the emergency managers too.
thanks.
Oh, I'm sorry, yes. Our phone number is 852-1376. I forgot there's not a separate number.
Right. Any other questions? One more.
Yes, so after someone does receive the vaccine, should they continue to wear masks, social distance, et cetera?
Yes. So until we have until we have the virus out of the community, out of the country, even, we're going to have to continue to wear masks and social distancing. No vaccine is 100% effective. So even if you're vaccinated, you're still at risk of getting a vaccine. You might have a lesser symptoms of the virus, but the possibility is still there. And until we get you think about polio vaccine, how that works is we have people protected against polio. So if that virus is to come into our community, we're blocking it with the people that are vaccinated. It's going to take us a long time to get that blockage up of people vaccinated against COVID. So yes, we're going to have to continue to wear masks and social distance and all that until we can get this virus out of our community.
Well, I just want to thank you all for tuning in, for the media to be here one more time, helping us share this important information. If you're, as I'm sure you are, watching our numbers, we're starting to breathe a little bit easier within this community. Our numbers are going down. The community has done a tremendous job practicing mitigation efforts. They are making the difference. And we see a light at the end of the tunnel, and it's getting brighter and brighter. The vaccine is coming out. These numbers are going down, but we just need to stay vigilant a little bit longer here. Let's keep the mitigation efforts going until we can get these populations vaccinated. And I assure you, we will do that as quickly and as efficiently as we can. So thank you for your attendance. Keep up the great work in holding the spread of this virus down. And we'll let you know when we have more information. Stay tuned. Thank you.